All right, doctor, we're now live.
Hey guys, it's Dr. Emer. We're here doing some BROTOX today. One of the most important things is keeping it natural, okay? If you take a look, let me show you. He's already young looking, but he's starting to get some of these fine wrinkles. Zoom on in, come in close, let's go. Show him these wrinkles, raise up as high as you can. You see where he moves, now relax. There's little wrinkles in the spots of that movement. So what does Botox do? What do all those neurotoxins do? They stop the movement of the muscle so that it softens it. So one of the benefits he's gonna get is prevention of these wrinkles from forming, but also it's gonna make the texture of the skin look better because it stops sweating, it decreases redness because of the constriction in the blood vessels in that area, and if he works out a lot and it makes you sweat, it's gonna stop the sweating. So you get all those benefits from the Botox. So squeeze in, raise up, and smile. Those are the three movements that we're going to particularly look at. He doesn't have much wrinkles here yet, which is great. So we're going to prevent it. Little pinch, 1, 2, 3. It's like a baby pinch. I always tell people baby tox is what we're going to do. We used to call this Broadway doses when I was in New York because we want it to look natural. If we need extra, he's pretty strong muscles here, you guys. If we need extra, we'll do it in about 2 weeks because that's how long we'll take to kick in. And that's the point where we would determine maybe you need stronger. The studies now show with men that they need about 30 units per area to make it last about 2.5, 3 months. So if you do the normal 20 units, 20 to 24, it might only last 2 months. Raise up, relax. So we're going to show you little points now. It's very important for males that we go a little bit more laterally than we do with females because otherwise the brow will become arched. And we don't want a sinister look. We don't want a Spock effect, and we don't want to change them to looking feminine. So we're going to keep it all looking natural. All right, so a little extra there. Perfect. And we're going to go all the way horizontal. Because look, when he raises, raise again, look at the lines. They extend all the way to here. If you stop in the traditional sense here, what's going to happen? That's going to go like that. And does that look pretty to you? No. It might look pretty, but not for a male. So let's now do the eyes. This is probably my favorite spot to do because in LA, what does everyone do all the time? They go out and they squint. So if you turn, look, he's starting to get some fine wrinkles here because he likes to be outside. If you guys know him, he's literally has pictures of him at every sunny place around the world. So when he smiles, take a look, smile, he's starting to get those little crows. So we're gonna work on, for him, going a little more lateral. And then we're going to sweep the tox right under the eye, just a little bit, right here, subdermal, right into that area where he's starting to get, this is the pinchy spot. Smile again, see it's right where, and then we want to go a little right here because I see where he's starting to move. Perfect. So turn, smile again, perfect. We're going to go a little bit on the edge, and then smile again, and then we're going to go right over here into the under eye area. Perfect. So you can go under and around the eyes, no problem. What are they saying on live, guys?
So Jasmine says, how long does it last?
Well, we already said that, so you can answer it, right? What did we say?
2 to 3 months,
2 to
depending
3
on how
months,
we...
Depending on what? How active somebody is. Typically, guys that work out, it's not going to last as long. How long did it last last time?
Like 2 months.
2 months. So if you did a higher dose, it would last longer, but what would be the negative? He'd be frozen. So he would literally have no movement at all. So we want to have some movement, and I don't want that, again, that angled look. So keeping it horizontal, midline and eye, and we're gonna get a nice prevention. So that was BROTOX today, you guys. We're gonna check in with him in a week and 2 weeks, because that's when he's gonna start to see it working. Actually, in a couple of days, it would be kind of fun because it gets a little funky. One part might start moving differently than the other. And it's gonna look all wobbly, and then he's gonna call us and say something's messed up. But that's not true. It takes 2 weeks, 10 to 14 days to kick in. So that was it. Thanks, guys. Perfect. So now all you need in a week is